In this short video, I will share best practices for writing treatment notes in Dentrix Enterprise. First, I'll talk about how to view treatment notes, then I'll talk about how to write and sign them. First, how to view clinical notes. So from the patient chart, find this clinical notes button. You can also press F9. The clinical notes button is available in the appointment book module, in the family file, and the ledger. So if I click on the clinical notes button, I'm taken to the clinical notes page. First thing I do when I arrive here always is press this Expand All button. And now you can see all the notes that have been written for this patient. You can always collapse all, but the first thing I do when I arrive here is Expand All. So you can see the different the notes that have been written for this patient. So in the first visit, the patient saw the doctor, and then they saw the hygienist. They came back and they had some fillings done. Then they had an ortho consult with Dr. Feldman. And then they were in recently for a crown prep. And on this, when you view the note here, you can see that the background of the note is gray. That means that the note has been signed and can no longer be edited. If you see a note that has a white background, that can still be edited as long as the date for the clinical note is within the current month. If the date of the clinical note is in a previous month and the month has been closed out, then the note can no longer be edited, even though the background is still white. There are three different ways to look at the Dentrix patient chart. And you can use these three buttons right here. It's the work chart, the full screen chart, and the progress notes. I find progress notes can be helpful, especially for those people who are used to looking at a paper chart, paper patient chart. If you click progress notes, you can see everything that's been entered for this patient. Things in blue are completed by our office. Things in green are existing, other. Things in black are conditions, and things in red are treatment planned. And over here on the right-hand side, you can choose which of these things you want to see. So if I don't want to see the things that are treatment planned, I can uncheck the treatment plan. I can uncheck the completed, I can uncheck the existing, I can uncheck the conditions. And if I click on clinical notes, I see all the notes written for this patient in order. So I can scroll to the very top. This is the first note for that patient. You scroll all the way down and see the most recent note. And I find this is very similar to a traditional paper chart and can be useful to those people who are looking at an electronic patient chart for the first time. You can always double click on one of these notes and be taken to the clinical notes window. When viewing clinical notes, I'll add that I often view clinical notes directly from the appointment book module. So if you select a patient in the appointment book and right-click, you can choose clinical notes down here, and it'll take you right to the clinical notes for that patient. Now, how to write clinical notes. So whenever you want to make a new clinical note, you click on this button, which says New Clinical Note. You can set the date and the time here, and in this space, you can write your clinical note. The first thing you need to do, though, is make sure that the provider ID and the clinic ID are correct. So I'm not RVC office. I'm going to use these two buttons, the button here to change the provider and here to change the clinic, to make sure that the provider ID and the clinic ID are correct. So I'm going to search for my name. And now I've got my name here, and we'll say that we saw the patient in Woodside. I'm going to paste my note into place here. After you write your note, it's important that you sign your note. So you click this pen button right here to sign the clinical note, and you enter your Dentrix password. You get this little prompt to sign your note. You don't have to do anything here at all. Just click the OK button. Now you've signed your clinical note, and the note background turns gray. If you want to make any changes to this, you can create an addendum. So you use this button right here to create an addendum. And I'm going to say that the next visit is 19 RCT. So it's not actually 6-month recall, but root canal treatment for tooth number 19. Get this note, that prompt, and you click that. So now we modified this note and wrote an addendum. Another thing you'll notice down here is that you can also create new clinical note pages, and this is when a provider or a patient sees more than one provider on the same day. So here they saw both the hygienist and the doctor, so there are two clinical note pages, entered, one by the hygienist and second by the doctor. So 3 notes on writing clinical notes best practices. The first is the purpose of clinical notes is to communicate what happened at each and every visit. So they should be written with the appropriate level of detail so that anyone reading them will know exactly what happened as if they were there. Second, every note should end with NV for next visit. And the next visit is from the patient's perspective, not from the provider's perspective. So if the patient has just finished their 6-month recall visit and their next visit is root canal treatment, then that should be the next visit written in the note. Now, if the hygienist wants to write 2 next visits, they can say the next visit is root canal treatment on tooth number 3, and the next visit, or the next hygiene visit, is 6-month recall. And the third thing is that every clinical note should end with the doctor and the assistant's name. And this enables anyone reading the clinical note to know who to contact if they need further information. In this video, we've covered how to view treatment notes in Dentrix Enterprise, how to write clinical notes, and how to sign them. I hope this is helpful.